Hi, and welcome to the Health Tech Crew podcast. I'm your host, Igor Gorlatov, and I'm fortunate today to have a renowned guest with me, Dr. Joel Selanikio. Dr. Selanikio is an accomplished physician and epidemiologist, noted for his contributions in technology, healthcare, entrepreneurship, and innovation. A seasoned keynote speaker and respected futurist, he navigates the intersection of technology and health, sharing insights on the transformative power of artificial intelligence and big data in a healthcare landscape. His outstanding work has been recognized by the Wall Street Journal with the Technology Innovation Award for Healthcare and the esteemed $100,000 Lemelson MIT Award for Sustainable Innovation. Dr. Selanikio is a much sought-after voice in the global health conversation, with a portfolio that includes consultations and keynotes at Davos, Nasdaq, the World Health Organization, UNICEF, Google, and Stanford, among others. His profiles have appeared in prestigious publications like Forbes, Wired, the Wall Street Journal, and more. As an emergency responder, Dr. Selanikio's frontline experience in healthcare is commendable. His roles have varied from lead physician at an Ebola treatment center in Sierra Leone to chief of operations for the HHS Secretary's Emergency Command Center after the 9/11 attacks, and he was instrumental in the COVID-19 response effort. Today, he continues to serve his community practicing pediatrics in Washington, D.C. So I'm looking forward to a thought-provoking conversation with Dr. Selanikio on the future of health tech. Stay with us. So Joel, thank you so much for being here today with me on the Health Tech Crew podcast.
It's a pleasure. Thanks for having me.
So I want to start with my favorite question about your career journey and professional journey. Could you talk a little bit about it, and what is your current position and what led you to your current position?
Sure. My career journey is one of these definitely non-traditional career paths because it takes a bit to explain it, but when I left college, I wasn't sure what I wanted to do. I had minored in computer science. I was kind of interested in that. And I wound up getting a job doing computer stuff. This is back in the late 80s for a bank on Wall Street, for what was then Chase and what's now JP Morgan Chase. And it was mostly database stuff, database programming. And, I found that very interesting. And at some point, and this is so far back, I can't quite remember the reasoning behind it, but I thought I wanted to become a doctor, and I hadn't been a pre-med, so I had to apply to a program kind of in secret, not telling my employer that I was applying to what they call a post-baccalaureate or post-bac program, which enables you within roughly a year to take all the pre-medical requirements and all that stuff. So after a couple of years at the bank, I left and went through one of those post-baccalaureate programs at Bryn Mawr College, and then went straight into medical school at Brown. And, I remember, and again, this is late 80s, and we're kind of right in the middle of the computer revolution, like the personal computer revolution, like a huge, unbelievable technological change. And I remember very clearly thinking to myself, well, that computer stuff was pretty interesting, but now that I'm going to become a doctor, of course, I'm going to leave all that behind. I don't think I'll be looking at computers anymore. And, and that was somewhat true, I think, for certainly medical school, especially at that time. And after medical school, I did residency in pediatrics at Emory University in Atlanta, and, didn't think very much about computers at that time either. When I was finishing my residency, for some reason, I had a lot of people tell me, maybe at least 10 people told me, have you looked into applying to this fellowship at the CDC down the road? Because the CDC is just a couple miles away from the main residency facility at Emory. And I'm not quite sure what it was they saw in me because, the fellowship had to do with epidemiology and public health, none of which I knew anything about, and international health, of which I knew very little. But people kept saying that to me. And so I looked into that program, which is called the Epidemic Intelligence Service, or EIS. And I applied to that program and got in and started working at CDC as a fellow for 2 years. And then I was invited to stay. So career journey was, didn't know what I wanted to do, worked a little bit in computers on Wall Street, went to medical school, did my residency, started working at CDC. And through that whole time, as I mentioned, I thought at the beginning of that period, I wasn't going to, like the computer part. At that point, you could actually think to yourself, well, computers certainly wasn't touching everything in our lives. And you just thought, well, it certainly is not, it doesn't touch healthcare or medicine or anything like that. And probably at the time that was pretty true. So I started working for CDC, and it was only after I began going out into the field, particularly in poor countries, and looking at the way that public health actually operates, that I began to think back on my time in terms of looking at information technology. And when I say the way things operate, well, first of all, I guess maybe your listeners may not know what I mean by public health, so I'll be clear. In my mind, as in many physicians' minds, there's a divide between clinical medicine. That's where I, for example, like tomorrow I'll be in the clinic. I'll be seeing individual patients, pediatric patients, and seeing what's going on, how I can help them, and treating them on an individual basis, clinical medicine. And then there's public health, which is where you are trying to affect good changes in the health of the population, but you're treating them on a sort of population level. So we all got a big taste of that, for better or worse, during the course of the pandemic, over the course of the last 2 years. But in most poor countries, and this covers probably more than half the world's population, most people don't have any experience with clinical medicine at all. They never see doctors or nurses or go into clinics. That's just too expensive to even exist in most areas of their country. So when I got out there, I started realizing, wow, if we want to, let's say, vaccinate kids in, Kenya, in rural Kenya, it doesn't happen at their pediatrician's office because they don't have that. It happens in these grand campaigns that happen over weeks or even months, where you try to vaccinate every single kid in let's say, a 3-week or a 4-week period in the country. And all of that, getting back to the IT part, all that is very data intensive. These processes, which are usually run by the Ministry of Health and a group of international organizations, it might be the International Committee of the Red Cross, might be International Federation of the Red Cross, might be UNICEF might be involved, et cetera, US government agencies like CDC. And for example, if you just tried to vaccinate the roughly, and no one really knows how many kids there are in, let's say, in Kenya. I don't want to pick on Kenya, but there's really a dearth of information. And you want to go out and vaccinate all the kids in a country where you don't actually even know how many kids there are. It's an interesting question. How do you find out whether you hit the target or not? And way back, it used to be that people just counted the number of vaccinations that were given. But of course, that just gives you the numerator, right? That tells you number of kids vaccinated, but it doesn't tell you out of how many. Again, in a country where you don't know what that number is, you have to get an estimate. And the way that's usually done is a household survey. So long story short, lots and lots of data is collected about how many kids there are in a particular region where a vaccination campaign occurred and how many of them got vaccinated. And that involves knocking on hut doors. And that involves doing that with 30 sheets of paper on a clipboard. And the 30 sheets of paper has 300 questions. And you're going to ask those questions at 15,000 households. And then that information is typed into a computer. Believe it or not, this process, as I just described, still happens a lot all over the world. I mean, it's really interesting when you realize that, like, you think, well, where can you get information on the health of kids in Vietnam? Well, you can Google it. The question is, where did Google get it, right? Where did the sources you find on Google get it? And the chances are it was a household survey that was used to generate a good estimate. As I started doing this thing, and as I was the person sitting in the tent or the little hotel room or whatever, typing these tens of thousands of sheets of paper into a computer, I thought, I mean, this is so archaic. I can't believe we do it this way. There must be some easier way. And that was the time at which what we would think of as mobile computing was just getting started, with things like the Palm Pilot. Very hard to explain this to young people today. You're like, well, the Palm Pilot was like a mobile phone, but without any connectivity at all. And
I
they're
actually had one, Palm
me
Pilot
too.
M125, I think was my model.
I had the Palm 5. That was the silver one. That was, that was, people looked at that like they might look at an iPhone 14 today. They coveted that Palm 5. But again, people say, well, why would you want one if it doesn't have any connectivity at all? And it was just a different time. But for our purposes, what those represented, those and other things that were produced by Microsoft and HP, et cetera, were the first affordable portable computer that we could actually use in the field, not a laptop that you can't walk up to a laptop that has no tables or chairs and balance a laptop in one hand while you type with the other hand. You need something that's portable like a clipboard. And those devices were the case. So I began to think of ways while still at CDC to essentially to create software that would enable us to do that purpose, to take questions and instead of typing them into Microsoft Word and printing 300,000 sheets of it, that you would just transfer them to 100 Palm Pilots. And that was the beginning of what later became Magpie, both the software, the Magpie software, and the company Magpie. Now, I didn't realize at the time when I first started doing this that my later to be business partner, Rose Donna, that she was working on similar stuff with a CDC physician named Mark Grabowski at the American Red Cross. And that was one of the organizations that participated in these activities. Later, we wound up connecting through Dr. Grabowski and wound up eventually at a certain point, I think both of us were somewhat stymied by the lack of interest in that type of innovation at those organizations and that we worked for, which I later, I think, completely absolved them of any wrongdoing there. I mean, I think it made little sense what I was trying to do in the context of those organizations. That's probably an interesting entrepreneurial lesson or intrapreneurial lesson. I kept beating my head against the wall, and supervisors were not thrilled that I was spending any time working on this unsolicited activity. And I was so convinced, and I think now it's been proven I was correct to be convinced that this would have tremendous benefits and really make things more efficient. I kept beating my head against the wall, and I was really kind of angry about it, and then I left, and Rose left, and we started Magpie. But years later, I was in another interview, something like this, and someone asked me about this process, and I said, thinking back, I realize now the foolishness of my own behavior, because it was sort of like you show up in a nice restaurant with a yoga mat, and you ask the maitre d', where can you set up and start doing yoga? And they're like, well, sir, this isn't a place for yoga. This is a restaurant. This is where people eat. And you get mad at them because they won't go along with your idea that it's a good idea to do yoga in restaurants. No one would go along with my idea that it was good to do that kind of digital or mobile innovation for that project. Anyway, so we, for better or worse, both Rose and I think, decided to leave our organizations and start what eventually wound up being sort of a company. But, in our minds, we weren't trying to start a company or be entrepreneurs or start a business. We just saw this problem that we were sure we could solve. And I think a lot of entrepreneurs who are listening to you or listening to this will understand what I'm talking about in terms of just when you have that feeling like you can't rest until you find out whether you're right or not. You can't rest until you have tried and just, maybe you fail, but at least you get it out of your system. That's kind of where we were at that time. So career journey wise, that was, I left my public health service CDC job. I was working at the time for the Secretary of Health and Human Services, and, we struck out on our own. That was sort of vaguely terrifying, no source of income, et cetera, but we wound up getting, and again, we weren't thinking about business per se, we wound up getting grants from a number of organizations, the World Bank, the UN Foundation. That really was sort of our seed money to get Magpie coded and have some version of it up and running. And eventually later on down the line, Magpie became kind of a very familiar, I think, concept of an online system that you can subscribe to via the web, et cetera, et cetera. And that Magpie started about 20 years ago. And in more recent years, I haven't had much taken up with Magpie. I'm involved with it sometimes on a design basis, sometimes on a business decision basis, but mostly I've devoted my time. Both, I do some clinical medicine, usually about 1 day a week. I spend a lot of time thinking and writing and talking to groups whether technology groups or like technology companies or healthcare companies or groups, clinical medicine doctors groups, et cetera, about technology and healthcare, technology and health, the future of those things, et cetera. And that's kind of what occupies most of my time nowadays. So I'll abbreviate it. Didn't know what I was doing, worked in computers, did medical school, residency, CDC, quit CDC in a bit of entrepreneurial something or other, and then spent probably about a good 10 years working solid, more than full time on Magpie to get that software up and running. And now, as I said, I'm thinking more along the general lines of technology and health and healthcare, which I would say Magpie is kind of fits into that. Maybe was my first thought along those lines of how to look at health and public health and technology at the same time.
Thank you for a very comprehensive overview and very tangible. I could imagine you sitting in a tent and kind of reviewing thousands of papers.
Yep. Excruciating.
Surprisingly, you mentioned yoga in a restaurant, and I just wanted to give an example of a company in Charlotte. It was called Work for Your Beer, where they had a similar idea, actually bringing mats not into restaurants, but into breweries. The idea was that you work out at the brewery, do yoga, and then drink your beer. So sometimes crazy ideas.
So you're drinking the beer afterwards.
You drink the beer afterwards, yes.
I was thinking at the same time, and I was wondering how that was going to work, because most people would probably fall asleep.
But you mentioned restaurants and yoga, and it sounds really strange, and I understand the point you are making, but sometimes you could take a different perspective on this. And I just recalled women who did it in Charlotte.
I would say, I have certain, skills and ability to talk with people and ways of communication, and maybe they were just the wrong ones to convince the people that needed to be convinced. So it might have been only the yoga in the restaurant problem. It might have been the particular entrepreneur to be, or it might have been the folks I was talking to. So a million different reasons. But at a certain point, you realize it's not working, and then you just have to decide, do I want to go for it or not?
Sure. Looking at your LinkedIn profile, there are a lot of things that are there, and you mentioned some of them, like a day of clinical work. But could you say what activities form the core of your paid work like these days?
Sure. Well, so the biggest one by far is the speaking, consulting, etc. I think after that would be just investments. As we've talked about earlier, offline. Just things like dividends from stocks, rental properties, that kind of stuff. So I do have a portfolio of those things, which I built up over the years. Good idea if you plan to be an entrepreneur or go off on your own to save and invest some money. So I'm happy that I've done that over the years. And then the clinical medicine.
And reflecting back a little bit on Magpie, you shared the story of 10 years you invested into building the business. And we're saying right now, the business doesn't require a lot of your day-to-day involvement. How did you manage to accomplish that?
At a certain point, we were, I think, what I might say is chasing features, like always thinking to add new features. And, to be honest, there are venture-funded companies that also do mobile forms that have products that are much more full-featured than Magpie. Generally, they're also more expensive. And we realized that, with our sort of limited revenue and the staff that it was able to support, that we couldn't compete with those guys. And we said, well, look, we do seem to have a core of users who like the product, and it fits their budget and fits their needs, and it supports our, tech support and programmers and all that kind of stuff. So why don't we, instead of aiming, we're never going to be going for some sort of IPO or something like that. And as I said, even when we started, we didn't even think of it as a business at all. It was just a project, just a thing we had to do. But it's not a bad thing to develop something that actually fills a need, helps accomplish a useful purpose, like making public health and some other fields more efficient, and supports itself. Most of the stuff that happens in technology and international development or global health is either government funded or just entirely grant funded. It's almost never funded by the people who actually use the software or hardware. And that has a whole variety of different problems in terms of who the software is designed to please. I remember, we were very grateful, of course, to get grant money from the grantors who gave it to us. that helped us get started. But I do remember at one point with one of our grant making organizations, and we had, received millions of dollars. At some point I was giving it was maybe our annual PowerPoint presentation of, what we'd done. And it occurred to me as I was doing that no one at that organization who had given us all that money to create this software, that no one there had ever asked for to actually use the software. Like no one had. I realized I went from that presentation, I went and I looked at our logs to see if anyone from that domain had ever created a user in the system, because there was like a free level, you could just create it for free, and no one had. And I checked our other funding organizations. I discovered that no one funding us had ever actually apparently seen the software outside of a demo or my PowerPoint presentations. And what it made me realize, and I don't think this is really applicable to commercial entrepreneurs, but it's definitely, I think, applies to entrepreneurs, intrapreneurs, as you phrased it, or folks who are working in the nonprofit side. I realized that, kind of to my sadness, that really what I was being paid to do from those organizations was produce not actually software, because if the software was the important thing, they would have asked to see it. What I was asked to be produced was the PowerPoint, the stories, basically stories about creating cool software that's used in Vietnam or Namibia or other out of the way places, and videos of kids, in rural places getting vaccinated, et cetera. Like I was contributing to those stories, but as it turned out, the software itself was kind of optional. And I just thought to myself that, I thought at that time that Magpie, the Magpie software was good, but I also thought if we're getting paid more to do the stories, at some point I'm going to be deciding what to do with our budget, and I'm going to put money into a videographer instead of another couple coders, because that's where the money's coming from the good stories. And I just thought that doesn't seem to me to be the path toward making better software to suit our actual users. I wonder if there's some method by which we can actually get the users to pay, which, of course, in commercial software, this is hardly a revelation, but it was then, and it still probably is the case that within global health and international development, generally there is this idea that you can never charge users, that somehow users in poor countries never have the money to do it, even if the real users are the United Nations or the CDC or other branches of the US government or other, large multi-million-dollar organizations. So we were the first to basically do that. We were the first with Magpie to create, Magpie was the first in a number of ways. We were the first self-service web application created for global health or international development. The idea that rather than the norm, which was having, let's have a bunch of people that look like me fly from Washington, D.C. to whatever rural place it is, do a couple weeks worth of training, blow $30,000 on travel, train everybody up, stay on the ground there, hold everybody's hand, to switch from that to more of a, what we pointed out at the time was the very common Gmail model, just make the software simple enough that no consultants are actually required. And people can just go to the website and they can sign up just like they do for Gmail. And, Mark Zuckerberg doesn't have to fly out to install, or the Sergey Brin doesn't have to fly out and make sure that your Gmail is working. So those were kind of, those were innovations that were in the world, were tried and true, but we're not in that world. And so we kind of helped that to happen. In those early days of Magpie, I think we did quite a bit of innovating, which mostly consisted of taking things that other people had thought of in the commercial sector and bringing them into that particular sector. But we did reach that stage where once we got to that subscription level, where we had this balance between the subscribers, the revenue coming in, and what we needed to do. And that's kind of where we are.
And if this is not privileged information, how big is Magpie right now in terms of revenue and people?
Oh, it's less than $1 million. Yeah, it's less than $1 million annually. But you'd be amazed. You would be amazed at the services you can provide for $1 million in revenue. I mean, you would just be, what with the sort of, for a long time, the cost of servers was dropping, what with AWS, et cetera. I think that it was kind of rising a little bit. Now there's a lot more competition between, Google's cloud product and Amazon's cloud product and Microsoft's cloud product. So I think certainly the long-term trend for things like servers. I mean, we wouldn't have been able to do Magpie, 30 years ago, that kind of stuff, or even 20 years ago when Magpie was not an online product. The cost of just the servers would have been hundreds of thousands of dollars per year. Now it's, I mean, I think the cost of our servers might be, certainly it's less than $50,000 a year. And every year they get bigger and faster and better. We have our staff is all over the place. So I do meet with Rose here in Washington when she's in town and I'm in town. But I was trying to remember the last in-person meeting we'd had, like all hands meeting, and I couldn't. We have some staff members who've been with us a long time who do a few, for example, in Nairobi, who do customer support. We have other folks who are just on contract from from websites like Upwork, where we just hire people for the long term. These are like long-term contracts, but they're contractors who do, server admin, et cetera, et cetera. But as I said, all with less than $1 million in revenue. And, it's kind of amazing to me.
It is amazing. And it's cool that the business found a niche, found its customers, and it's self-sustaining and doesn't require your direct involvement. So it's
not on a day-to-day basis to sort of keep things running or to respond to a customer question or that kind of stuff. And the other thing too, I think, as I said, we were really trying to get away from what had been Rose and my model when I was at CDC and Rose was at American Red Cross. We were the people who flew out to the countries to train people and do the installations and do that stuff with technology. Our whole goal with Magpie was to eliminate the need for that role. And so I remember at one point talking to someone about, a lot of users were having trouble, or we're getting a lot of tech support requests for a particular thing. And I said, guys, if we're getting that many tech support requests, like that's not a tech support problem. That's a design problem. Like there's something wrong with the software if the average person can't figure out how to do that simple thing or runs into a problem with that simple thing. So let's look at that problem so we can eliminate the customer support, because frankly, customer support is a lot more expensive than programming, right? So, that's kind of been what's driven us the whole time, is say, like, we really, we have to keep our costs down. We have to keep this thing running, and we have to look at every opportunity to, in effect, every opportunity to remove the human connection between us and our users. That's a terrible kind of way to say it, but in a way it's true, because you realize that human connection, in fact, was and still in many cases continues to be the obstacle within international development from having people actually able to use the software that folks create. Everybody in a city in Laos has a Gmail account or a Yahoo account, and uses Facebook, et cetera, et cetera. But in terms of the other stuff, the software that's produced within that sector of international development, it's hard to find people who can figure it out or can have the wherewithal to get grant money to fly out a bunch of consultants to teach them how to figure it out.
And I wanted to jump into healthcare based on this conversation, because in our previous chats, we talked about like scalability and removing the doctor from the equation. So while we aim for scalability and accessibility in healthcare, do you see any potential risks in removing the doctor from the equation?
Yeah, I get asked this question all the time. And I always respond, first of all, by pointing out that for most people on Earth, there's no doctor in the equation. Right. So we can forget about the risk of removing the doctor there, right? Literally, most people on the planet have no doctor or nurse or even a community health worker, right? Now, for those of us who are lucky enough to live in places where we can, we do have access to a doctor, I think I would have a different answer if, for example, in the United States, the healthcare system was terrific and people's health was great, and our, for example, life expectancy was on an upward swing, as it has been for most of the last 100 years, only recently to be reversed. Another way to think about it is, if the ship is fine and steady and you're in calm seas and everything's great and you're not taking on water, I think you can be more risk averse. I think when the ship is taking on water and lifespan is decreasing and healthcare costs are out of control and people's experience with healthcare, the customer experience, the customer service is abysmal in healthcare. It's really, we certainly, I think, have made great strides in terms of let's say, cancer treatment, cancer therapy. So if you have cancer, I think the United States can do a good job of treating you. Maybe not the best job of treating you compared to our rich country peers, but a good job of treating you still. For a lot of other stuff, it does a terrible job, especially for the things that actually ail us in the United States, like obesity and alcoholism and drug abuse and all those other things. Healthcare has demonstrably failed to really make a dent in those things. So to get back to your question about, is there really a risk at doing it? It's like, well, there's a risk at continuing down the current path, an enormous risk, and that is directly manifest in our decreasing life expectancy, which started long before COVID showed up. It's not just a COVID thing. So that's my thought. I think right now we're in trouble, and we need to experiment more, not less.
So I saw this connection between you automating your kind of business and talking about healthcare in general from our previous discussions. Do you see other insights that you kind of took away from your experience first in the banking sector and then at CDC and as a pediatrician that affect your perspective right now?
I think in terms of insights, there's sort of personal ones about entrepreneurialism, et cetera, and one of which might be, take risks, especially when you're young. I'm a physician, and when I took what I thought of as my greatest risk, which was quitting a very cushy job working for the Secretary of Health and Human Services, nice government job, very secure, prestigious, and quitting that job. And I agonized over that for a year, probably, oh my God, what if it doesn't work? What if it doesn't work? What if I fail? And it was only, someone sort of figuratively smacking me in the face and saying, stop whining. What are you talking about? You're a doctor. You're like, your worst case scenario is you go work in a hospital. But I mean, if I can have that mindset, certainly you can imagine that other people with less of a backup, even more so, have that, be risk averse. And I was just talking to someone about this recently who's in their late 20s about, they're like, oh, I want to try this. What do you think? But everyone's telling me it's a bad idea. I'm like, when, if not now, do it. Do it. If you are in this country, if you're in the United States, if you're in Western Europe, then probably the number of things you need to screw up seriously to wind up sleeping in the streets are exceedingly high. You'd have to really, really screw up this and that and the other thing. If we're actually having a conversation about you wanting to start a company, I think go ahead and start that company. So there are those personal kind of things, but there's also, I'd say the most formative experience that I had, and that really informs almost everything that I think about and write about and talk about nowadays, was just that when we started creating what became Magpie, purposely emulating, openly emulating, as I said, this kind of Facebook Gmail model, which was, that was new around 2000 or so, right? People, you used to have to buy software in a box, it was complicated. When we started purposely emulating that, kind of word got out somehow that we were doing this, but it was, sort of a nonprofit-y kind of thing or whatever. And I started getting invited to a lot of Silicon Valley conferences. Just as with the people who had funded us, I think in many cases I was being told to tell stories. This was another group of people who wanted to fly me out to California to tell stories. Isn't that cute that they're using, software as a service, but to do child vaccination? And I don't mean in a condescending way. People were genuinely interested, but you could tell no one was expecting to learn anything from my talks that I would give, let's say at Google, right? I think they were expecting to be entertained and interested. That's an interesting world that we don't know much about. On the other hand, I went out there not really knowing what to expect and was immersed suddenly. I had, all kinds of people that I met, people I became friends with, who were immersed in technology, software, innovation, and entrepreneurship. And even just the concepts which I had been sort of forming in my own mind, things like software as a service, et cetera, I didn't even know the terms for them. I'm sort of making up terms in my head that I'm using to think about these concepts. And then you realize, of course, there's an entire vocabulary. There is a playbook that people are using. And that was just incredibly important for me, just again and again and again, being able to, just you're having a beer after the conference with a group of people that are, in some cases, famous people, or leading entrepreneurs, and just quietly sitting in the back and just taking in everything that you possibly can, and getting as many book recommendations as you can, and how can I learn more, et cetera, et cetera. So that was, I think, that was huge. One example of that, I think, and this applies to, I think, any entrepreneur, but particularly those who work in IT, would be the work of Clayton Christensen, the former Harvard professor, unfortunately, who died within the last few years, who created the concept or popularized the concept of disruption, of disruptive innovation, and in this book, The Innovators Dilemma, back in the 90s. And I remember very clearly that one of these people that I had met out in California, I think it was at a, there's a company called O'Reilly Publishing. They publish a lot of programming manuals, et cetera. Usually they have animals on the cover of the manuals. So I was invited by Tim O'Reilly, the head of O'Reilly Publishing, to come out to a thing called Friends of O'Reilly, or FOO, Foo Camp, which is a wonderful, what's now people call an unconference. There's no schedule. It's by invitation only. And you get there and you actually camp. Like, people brought tents and camped on the O'Reilly campus, which is just north of San Francisco. And there's a big schedule board that's blank. And after dinner on the first night, everybody goes up, and you are expected that if you were invited, you have something to say, and you need to schedule yourself in at least a few, and talk to people about a few things. And at one of those things, I remember someone gave me a copy of The Innovators Dilemma by Clayton Christensen. And, I thought it was a nice gesture. They obviously had kind of driven out for the conference, gone to a bookstore, bought the book, and brought it back. I thought, that's awfully nice. And I brought it home and I tried to read it, and it was gibberish. This is quite early in my kind of Magpie journey. A few years later, after we had kind of made the move, or were thinking about the move to doing the kind of Gmail approach, software as a service, I was in the process of painting part of my house, including the part that had the bookshelf where that book had been stowed unread. And the whole room is like covered with plastic drapery. And I'm standing like in cutoff shorts and a t-shirt. I'm speckled with paint, and I see the book on the shelf, and I'm getting ready to move the books off the shelf. And I took the book off the shelf, and I was like, "Oh yeah, this is that gibberish book that guy gave me at Foo Camp." And I, looked at the back cover, looked whatever, and I started reading it. Started reading the first chapter, and I read the first chapter standing there in front of the bookshelf, and then I kind of, without taking my eyes off the book, backed away to the couch, which was covered in plastic drapery, and I sat down on the plastic drape, and I basically spent the next 3 or 4 hours just reading through the book. And then I got on the phone to Rose and I said, "Rose, you have to read this book. This book is about us. Like, this book is about exactly," and it was fascinating to me how, like, I just wasn't ready at that earlier time. I hadn't thought through enough to understand the insights that this, exceedingly brilliant guy was laying down, and the insights which, to bring it back to the present, which still lay, this is the groundwork for innovation in Silicon Valley. You don't find folks who don't understand what Christensen was talking about when he talks about innovation and disruption. Although, of course, nowadays people use disruption in all sorts of ways to refer to all sorts of stuff that is not what he was talking about. Folks who are actually in the lead of in the entrepreneurial lead for IT all know what he was talking about. And finally, I was like, I'm in it now. I get it. Like, I get it. So, again, lots of insights along the way, but I think I was lucky enough that I had that. I was lucky enough that I was working in a quirky enough field with technology to actually get invited to talk to some of the giants within the field, and just keep my mouth shut as much as possible and listen to what they had to say.
I appreciate you sharing, again, very tangibly what was happening through your head. And one thing caught my attention when you said you were invited to talk about like the work that you were doing in different countries. And the purpose was not to learn, but to be entertained.
Yes.
But usually this entertainment is opening people's minds to a certain impact or change or a different perspective. Have you been able to observe that change? Like, what are the things that people say they take away from your speeches, presentations, that, I don't know, you find impactful or surprising?
So I would say back in that early stage when I was going out to Silicon Valley and attending those conferences, not much. I think people mostly were entertained. And I think I did get some folks, talking about things after the lectures. I did get some folks talking about how they thought it was quite interesting how we were reaching a stage. And interesting, I would say, stepping aside is the understatement of the millennia, that how interesting that we're suddenly in a situation where every person on Earth has a computer in their hand, connected to a worldwide network. And therefore, they are, in technological parlance, addressable, right? That these are people we can communicate with instantly. These are people we can sell stuff to, like cell phones and the software that runs on it. These are people that we can show ads to, et cetera. So I think some people, even at that stage, and this was, again, around 2000, about 20 years ago, some people were into that. Obviously, folks at Facebook who later, plunged full-throated into the developing country scene realized that there were enormous market opportunities there. But for most people, I think it was mostly entertainment. It's quite different today now when I talk about those advances in technology, mobile, the consumerization of technology, more recent stuff like AI, which I really view as just kind of a continuation of the same processes. Now, I often say when I address a group, and that could be a group of coders or IT folks, or it could be doctors that are in practice, or it could be healthcare company executives, or different groups. I will often say now that my goal in the talk is that over the course of let's say 45 minutes or an hour, that I will give them one important insight that they did not have before they entered the lecture. And that my secondary hope is that during the course of the question and answer session, and this is always true, that I also get something that I just absolutely didn't know before I went in. Because at a certain point, it occurred to me that was the case. Like I may have mentioned this to you before, but the fact that we now are starting to get good evidence that primary care visits in the United States are rapidly diminishing. But I have at least a few times talked to the C-suite, right, including the CEO of the largest primary care organizations in the United States, and I have found that going into that my talk, they were not aware of this. Now, how could that be true? I still, my mind reels at the possibility this could be true. I can think, well, I guess they're just too involved in the process. They're reading the same blogs, or they're reading the same this or that, or the same newspapers or whatever that just doesn't have this in there. But how powerful an insight is that if you're the CEO of a primary care organization? I mean, just to plant that seed, hey, maybe this guy Joel is crazy, but I think at least I'm going to look at those references that he provided and try and figure out, does this actually materially affect what I'm doing? Also, I would say in general, moving from the tech crowd to the physician or healthcare crowd, aside from some of the MBAs that are in the C-suite, or some of the MBA docs or MBA nurses, most people haven't got the slightest idea. They have lived through astonishing technological changes in their lifetimes, and they're absolutely unaware. They have literally, in many cases, never thought how that might apply to the practice of medicine or the improvement of people's health. They have literally never thought about it. I've kind of stopped marveling at, because it's just, I just realized this is one of the reasons why I'm able to, make a living talking to people and talking to them about these things, because for whatever reason, I'm kind of obsessed with this and obsessively read about it and think about it and try to find as many, we were joking about ChatGPT, or trying to find as many opposing viewpoints to, challenge me on my views, because you just realize that most people just don't have the time or whatever to think about those things. But there's definitely been those kind of insights that I said, depending on whether it's a tech audience or a health audience or a international development audience.
I have one last question for you, and
sure.
I appreciate how tangible, again, you're sharing your perspective and how it's tied to your direct experience. When we talked before, we talked about the gaps between health and healthcare and perceptions of people. And we don't have time today to delve into this, but I wanted to ask about things that excite you any companies, products, or opportunities that could bridge this gap in your mind and make some people very rich and some people a lot healthier?
Well, I'll give you just one example. I think there's a huge psychiatric crisis in the United States, a huge mental health crisis for a lot of different reasons. And I think, of course, we would want to find out why. Why, for example, is depression so rife among teenagers, particularly among girls? Obviously you want to get at root causes, but in terms of treatment, we have effective treatments for things like depression and anxiety. Some of them are things like cognitive behavioral therapy. It's very kind of cookie cutter approach to typically kind of a talk therapy with a therapist. That has now, I think, been very effectively automated. And this is even prior to ChatGPT. So, for example, one company, I have no affiliation with them, but I do admire their work, is Woebot, WOEBOT. So Woebot, for several years now, and they were founded by a psychiatrist. They've gone through the process of trying to automate things like cognitive behavioral therapy, so that rather than going to a therapist's office and sitting there, you have a chat with in a messaging app on your phone. And what they found, and it's still early days, but the early findings are that people, and I think they're finding this with ChatGPT as well, that people create some kind of a bond with the algorithm. They know that it's an algorithm. They know it's a computer. They know there's no one really there. But when they're asked, do you think that Woebot, cares about you? They say yes. So, aside from the parlor trick aspect of it, what you have is essentially, the bottom line is a very effective treatment for, let's say, depression, that rather than having to be slowly and painstakingly done by human therapists who have never been able to reach even the number of people who need that therapy within the United States, much less all the people in all those other countries who don't have access to anything. Now, conceivably, you can imagine that this therapy can be made available to every single person on earth who might benefit from it. And more than that, you can imagine, again, looking at the trajectory of technology and software, you can imagine that would become free, right? That the cost of therapy would change from so expensive that it doesn't exist in your country, or in the United States, so expensive that your insurance doesn't cover it, or you don't have insurance, or you can't get it, even in the United States, to it's just another Gmail, right? That to me is just an unbelievable example, and just one of many, many different examples of how people are thinking about using the technology. And again, even prior to AI, which is of course a fascinating addition to the toolkit, but using just the techniques of mobile software and the software industry to automate these processes that are just absolutely essential for health.
Thank you so much, Joel. Thank you for those amazing insights.
Oh, it's my pleasure. Hope to do it again.
Well, that was indeed an enlightening conversation. Big thank you to Dr. Joel Selanikio for sharing his profound insights on the future of health tech. Your expansive experience and knowledge have truly enriched our understanding of how technology is driving healthcare forward. Now, before we wrap up, I want to take a moment and acknowledge the hardworking team that makes these important conversations possible. I wouldn't be able to bring you those insights from the front of health tech without the unwavering support and dedication of our home team at Kepler. Kepler is not just our sponsor, they're the engine that powers this podcast. They're a custom software development company that specializes in health tech, crafting top-tier software solutions for fast-growing healthcare companies. Their expertise and commitment to innovation are central to the work we do here at the Health Tech Crew podcast. As the Director of Strategic Partnerships at Kepler, I see firsthand how Kepler's incredible team is at the heart of these engaging discussions. We are proud to help bring the leading voices in health tech like Dr. Selanikio to your ears with every episode we produce. Thank you again to Dr. Selanikio and all of you for tuning in. Stay healthy, stay curious, and keep exploring the fascinating world of health tech with us. Until next time.